Thanks, Debbie, and it's great to be here. A few months ago, Phil asked me if I could sort of do some thinking for the Heinz Endowments, given the planned resurgence of population and economic revitalization in the Allegheny County area, of how to make sure that we incorporate air quality and public health considerations into these emerging development plans that are moving forward. So this is a summary of the thinking that I have to date. It's not to make a point, but it's just to maybe stimulate and motivate and encourage the thinking that's already going on in this area. I want to just make a brief mention of the picture here, because even though a lot of my talk is going to be focused on pollution and reducing pollution, I think there's also, along with the challenge of that, there's also the opportunity of envisioning a better world and a better society, one that is healthier, and that there's a lot of really positive energy that can go into this type of transitional thinking. My purpose here is to provide a general context for incorporating public health and air quality considerations into Pittsburgh area's urban planning decisions. I'm sort of envisioning it as a scaffolding of a building that could probably be put in any community, but in order to really understand how it's going to work in the Pittsburgh area, there need to be a lot of local considerations around the politics, the culture, the history that may not apply or probably don't apply to other examples that I'll be referring to later on. So this is just to provide a sense of what some possibilities might be, and then to identify next steps of how we might move forward in that. To begin with, I'd like to sort of follow up on Phil's comments around the air quality graphs that he showed, and that we're really looking at a transition of thinking from the air quality, the Clean Air Act that was promulgated in 1970, where the underlying presumption was that we could identify a air quality standard that would protect sensitive populations with an adequate margin of safety. And this presumes a threshold, so that there's theoretically an exposure level that you could identify that below which there would be no risk of adverse health effects. We're finding that both with carcinogens and with non-carcinogens, for different reasons, that those threshold hypothesis really doesn't apply. For carcinogens, the thinking that has been around for a long time, both in terms of the epidemiology, but also in terms of the toxicology and the biochemistry of carcinogens, is that there's really no safe level of exposure. For non-carcinogens like ozone and for some of the impacts of particulate matter and so forth, there's really no threshold down to background concentrations. The epi studies have been very progressively convincing in showing that these health effects do occur. And it's important when you look at like the slides of the moderate or what are called, I think what Arden Pope referred to as the not good air days, that a lot of those risks, a lot of those health impacts occur at levels that are above a background level but below the air quality standards. So what we're working on now is this concept of not so much a bright line, but how can we reduce risk as much as possible, reduce exposure, and realize health benefits from those reductions in exposure. And I want to start with a model that I think is very useful, and it's from the European Union. And it's the general document is the thematic strategy on air pollution. And rather than coming up with a specific level of pollution exposure for these European Union countries to achieve, what they looked at was how can we reduce actual morbidity and mortality from ozone and particulate matter. And they had two major goals. One was the 47% reduction in loss of life expectancy as a result of particulate matter exposure that would be achieved by 2020 relative to year 2000 as an interim goal, that they still had a long way to go beyond 2020, but this could be a metric that could be very useful in terms of how they would design their air pollution control strategies. And similar, what they proposed was a 10% reduction in the acute mortality from ozone exposure along the same line. So this, what stimulated my thinking in this area is that this is a really dynamic pattern, a really dynamic focus where you're on a continuous improvement goal, that you don't just reach a certain level and say we're done, but you're actually continually trying to improve health outcomes in these various areas and throughout Europe, and I think is a good model, and it's something that's emerging in the United States as well. And this is just a map that shows the actual health benefits that could be achieved, say from a reduction in the particulate matter. On your left is the current situation in terms of life expectancy reductions attributable to particulate matter, and on the right is where the what sort of improvements could be achieved through enacting pollution control laws. And the specific colors and the specific scales here is not as important as just seeing this amelioration of the intensity of the colors and the pattern that we're seeing throughout Europe in terms of a healthier environment. And I think it's a real model that we'll be pursuing, and I hope that we'll be pursuing certainly in the Pittsburgh area, and will be highlighted, I think, in subsequent talks. I wanted to start with London as an example, and in starting with London, I wanted to go back in time to the restoration of Charles II. And there was an essayist named John Evelyn who was very concerned about air pollution at the time. And he wrote this treatise for Charles II called Fumi Fugium, which literally means fleeing fumes or fleeing smoke. And he was concerned about the air pollution in London at the time, and also saw London as and with Charles II coming back into power, with the Stuart monarchy coming back into power, sort of a new enlightenment for the area that could be reflected not just in the governance but in the quality of the environment. And this was a particularly apt quote that I found in the document that could probably be found in the Pittsburgh paper today, where he was concerned about the fact that there was all of this air pollution in London, but that nobody seemed to be all that concerned about it. A lot of it was resulting from coal burning, particularly very high sulfur coal from the ocean, from the sea, from the beaches that had a lot of pollution but not that much heat, so people burned a lot of it. And most of it came from residences, I believe. But another interesting aspect of his essay was that he actually put forward recommendations of how pollution could be reduced in London. And the three of the most important ones were, first, the use of cleaner burning coal. Second was that they would remove the polluting sources from the people in London, from the inner city of London out to the outlying areas. And then the third was a sort of an interesting idea around putting a sort of a ribbon of gardens and trees and gardens around London, about 150 feet wide, that could protect the citizens of London from the air pollution sources. So there's some vague correlations, I think, between these ideas. Certainly the low sulfur fuel regulations that we've been dealing with, we've been enacting. The idea of setbacks or removing separating the pollution sources from areas of population. And then this idea, this emerging idea throughout the world and certainly in different cities, of having these various types of vegetation barriers, green space development to mitigate the impacts of pollution on people's exposure. We fast forward a bit to currently in London, and this is a picture of Admiral Nelson. There was a Greenpeace movement a month or so ago that put gas masks on all these famous statues throughout London, and it's in the midst. London right now is in the midst of dealing with air pollution problems, a lot from motor vehicles, a lot from traffic. And they've enacted since 2008 an idea of a low emission zone for vehicles, and that this proposal is, as I mentioned, about 6 years old at this point. There are also considerations of developing an ultra low emission zone that would come into effect in 2020. The idea of a low emission zone is that it's designed to reduce tailpipe emissions from diesel-powered commercial vehicles. And as you can see from the map, it applies to most of Greater London. And what it is essentially a mechanism of charging non-conforming diesel vehicles with a charge if they enter these zones, these clean air zones in London. And it's a motivation for sort of fleet transformation from dirtier burning diesel to cleaner burning diesel. Stockholm is sort of another example around traffic-related air pollution mitigation efforts. This came from the Stockholm website that shows nice, happy people in a inner city of low pollution, and everything is fine and dandy, but Stockholm actually does have some fairly serious air quality problems. And one way that they've chosen to address these problems is through the idea of a congestion tax, where it's, in my mind, at least in my simplistic view of this, it's sort of like the Easy Pass type of system that we have on the highways, where you have a little sensor on your car and you go through the toll booth and you get charged a certain amount for using the highway. In this situation, there are 18 charging points around the city of Stockholm, and when vehicles enter these zones during particular times of the day, they will be charged a fee for entering the area. And there's no charge. I mean, there's no direct charge at these stations, but there are. The owner is basically sent a bill at the end of the month based on the vehicle's license plate. Moving to the United States, San Francisco is a fairly intriguing example to me, because at least my understanding is that San Francisco has air that, in terms of ozone and particulates, is at least as poor as Pittsburgh, and according to the State of the Air report, is even dirtier in terms of particulate air pollution and ozone. What the San Francisco Health Department has put into effect is a enhanced ventilation system requirement as part of its health code. And what it does basically is that it requires a high efficiency filter called a MERV, or minimum efficiency reporting value filter, to be put on any new or modified sensitive use building within an air pollutant exposure zone. And I'll talk about what these mean. Basically, the MERV filter is designed to pick up these fine particles, these particles, the PM 2.5 level of particle exposure that's responsible for the most significant health effects around particulate exposure. And It's not occurring in many of these buildings right now. It's a more of an enhanced filtration requirement than most buildings have currently in the country. What a sensitive use building means in terms of the San Francisco Health Code would be residences, it would mean schools, it would mean healthcare facilities, basically any place where vulnerable populations may exist and where there needs to be particular consideration of their exposures. The health department has also developed a air pollution exposure map, which would identify various areas of the city that would be subject to these MERV 13 requirements around these sensitive use buildings. And for all locations, they are based on an annual PM 2.5 measure of greater than 10 micrograms per cubic meter, and also oops, I don't think that came out too well. Cancer risk level that would be greater than, I believe it's greater than 100 per million. And that all areas that are within 500 feet of any freeway. And then they also went a little bit further. Still looking at a metric that would consider both the ambient PM levels and also the cumulative air toxics or cancer risk level. But they looked for vulnerable populations. They also identified this concept of a health vulnerable population that would have even lower or tighter standards, which would be greater than 9 micrograms per cubic meter or greater than 90 per million lifetime cancer risk, still within 500 feet of any freeway. And the health vulnerable populations gets to the idea of the sensitive populations in a real way. And it's based on actual hospital discharge data, primarily from those areas that have abnormally high or unusually high respiratory or cardiovascular related hospitalizations, non-accident related mortality, and other criteria determined by the director of the health department. The non-accidental mortality, I think, is very important because there are a number of studies throughout the country, and there's studies even going on in Allegheny County area that are looking at the specific metric of elevated internal cause mortality or internal mortality in relation to, or all-cause mortality in relation to air pollution levels, and they're finding significant correlations. Again, as I mentioned earlier, down to basically down to background concentrations. And the interesting thing about Pittsburgh is that we can do these sorts of comparisons. These comparisons have been done. Phil showed a couple of these slides along that line in his talk. We have maps, for example, that show where the areas of elevated particulate matter concentrations are. And this is a comparison of the elevations in the Pittsburgh PM levels compared to the elevations in San Francisco. These are not quite to scale. I mean, they're not the similar types of metrics or the similar types of break points for these exposures. But I think it gives you an idea of what we can do in terms of applying the various types of mapping efforts that have been done by Albert Presto and others in the Pittsburgh area to identify these air pollution zones, and if we can correlate that with hospitalization data, ED data, and so forth, we can identify particularly vulnerable areas of the city, similar to what San Francisco is already doing. Again, as I mentioned, San Francisco looks not just at PM levels, but they also look at air toxics, cancer risk. As I mentioned, their cut point for vulnerable populations and sensitive use requirements is at 100 per million lifetime cancer risk. We have certainly those zones, those areas in Pittsburgh that exceed those levels, both from diesel sources and from point sources. As Phil mentioned, the point source risk largely from the coke ovens, but there are other point source contributions to this risk as well. I'd like to finish up with an example from West Eugene, Oregon, which is environmental justice community. It's largely Hispanic, largely low income. This is a picture of a creosote treatment works that's located approximately a half a mile from a school. And what's interesting, I think Dr. Brower will focus a lot more on these sort of specific applications of how we might consider setbacks and actual activities that can be done to reduce exposure, reduce risk in his talk. But I thought this was interesting. When you look at the map of West Eugene, Oregon, you can see a buildup or a high concentration of industrial sources that certainly work, such as what Penn Environment has done and others in terms of locating high risk sources, point sources within the Pittsburgh area. There's certainly correlates there in terms of what's being done in West Eugene. And one thing, another project that was interesting, or analysis that was interesting with regard to these point sources, was that they actually mapped the proximity of point sources around schools and then correlated that with the percentage of students with asthma in these schools. And they found a fairly significant correlation between the number of industrial facilities within 2 miles of a school and the percentage of students with asthma. And it went from, there was a low of perhaps 8% up to a high of somewhere between 15 and 20%. Sort of the other question that's not asked at this point, though, or at least with regard to these asthma rates, is why are these asthma rates so high to begin with? In this slide, where they compared the elevated rates of asthma in the West Bethel schools, which is in the environmental justice area, with the non-environmental justice area, they found a difference of between 14% and about 8%, or roughly 1.5 to twice as high, 2 times as high. But the interesting point, I think, certainly in terms of asthma and how we deal with asthma over its various types of risk factors and challenges, is that we're looking at a situation where the asthma rates 20 or 30 years ago were much lower than even the control or relative control community, where we're looking at maybe 3 to 4% asthma rates, and now we're looking, even in maybe the best of circumstances, rates that are considerably higher than that. But it does point out the environmental justice considerations with pollution exposures and these particular populations, particular areas, and that asthma may be not only important in itself, but may be important as an indicator of a number of other health metrics that may also be affected by the location of industrial facilities, the location of freeways and high pollution areas in EJ communities versus non-EJ communities. And so there's it was an interesting document that the Eugene Health Department put together a couple of years ago in terms of looking at options that the city could consider as far as reducing exposure to populations, to the vulnerable populations in the area. One of the recommendations concerned buffer zones. For example, having this 500-foot setback from freeways, maybe larger setbacks from other sources. They also wanted to consider risk-based permitting requirements. This was based on the work that came from the California Environmental Protection Agency, where they provided guidance to local air quality districts in California on how they could devise air pollution control programs that could minimize or reduce as much as possible the risk from the sources within those areas, both area sources, the sort of the wood burning sources, the residential sources, but also mobile and point sources. They also had a recommendation around performance zoning requirements for safer, cleaner practices. This is similar to the cancer-free economy work that my colleagues at Lowell, Holly Hoppin and Molly Jakes and others are involved with as far as transforming the economy of the area from one that relies on toxic carcinogenic compounds to one that's more of a greener, sustainable building practice. And we'll actually be having a meeting following this summit to further that conversation. They also had a recommendation around a forced phase-out type of requirement that would look at sources that are non-conforming in terms of the recommendations and criteria that they put into place for these areas. And if they can't meet those requirements, they would have some means of ensuring that these sources were somehow relocated away from these areas of high vulnerability. And finally, they had this idea that I'm thinking is probably in the works in the Pittsburgh area, at least under consideration, of a sustainable development code, which would look at, in a very comprehensive way, issues around pollution, issues around enhancing development, enhancing sort of the overall cultural evolution of a community that considered climate resilience, considered environmental justice, considered a whole variety of important metrics that needed to be considered as a city moved forward into a new type of paradigm around putting health at the center of environmental planning decisions or community urban planning decisions. And so that's basically the sort of where things are at this point. There are a lot of things that I didn't mention that need to be considered. Just didn't have the time or the space to deal with them. It doesn't mean that they're not important, but it's as I mentioned, it's the beginning of the conversation that I'm hoping will be a very engaged and vibrant and multi-perspectival one, including issues such as environmental justice, community engagement, which is particularly important in terms of taking these sorts of concepts and actually making them work in a place like Pittsburgh. The tremendous potential we have of linking the science that has been generated in the Pittsburgh area in the southwestern Pennsylvania into public policy. The whole issue of indoor air quality and the intersections of indoor and outdoor air quality, which are huge, and as Phil also mentioned, the initiative around reducing outdoor contaminants in indoor spaces, the RACUS project, is a vital one in terms of understanding that even though we have buildings, they're not a they're a relatively porous barrier in terms of outdoor pollutants. And considering the fact that up to 80 to 90% of our exposure to outdoor pollution occurs while we're indoors, it's vitally important that we understand how we not only have healthful outdoor air, but also have healthful indoor air in terms of controlling the sources indoors and the intrusion of outdoor sources into environments. And then the whole broader concept around green building design, building not just individual buildings, but community development efforts that look at sort of an ecosystem type of perspective of how we can optimize the healthfulness and the attractiveness of neighborhoods, and from neighborhoods to cities to counties and so forth. And then I finally just want to wrap up with this concluding thought, which came from a historian of science a couple decades ago. And he said, generally, pollution ideas are the product of an ongoing political debate about the ideal society. By extension, therefore, one can argue that in many past times to write about pollution, as was the case with Fumifugium, simultaneously to write about other social and political issues. Historians interested in all aspects of environment, from architecture and town planning to science and public health, need therefore to attend to the various layers of meaning which coexist within the representations that they study. In other words, this particular effort is part of a much broader conversation that we are all part of in terms of the future of any sort of community, including Pittsburgh. And that's my talk.